So let us solve these questions from Study Medic. They have got the question banks. This one is 15 questions are there. 20-year-old woman, Halston Lewis, radial nerve, submit. 25-year sky instructor who falls off the sky lift and sustains a spiral fracture of the midshaft of the tibia. Attempt to achieve satisfactory position in the plaster have failed. Overlying tissue are healthy. What is the appropriate course of action? Now, tibial fracture is there, open reduction, internal fixation. So, spiral fracture midshaft of the tibia. Attempt to achieve satisfactory position in plaster have failed. Now, this has failed. Open reduction and fixation with a long plate, whether plate or nail. Overlying tissues are healthy. So tissues are healthy means you can put, but this has failed. So long limb casting, amputation, skeletal traction. Out of this B and D. So intramedullary nail, it may be primary. Now we need, I think this is open reduction. You have to reduce, clear, and then put the, let me choose this. Next question. An athletic 15-year-old boy presents with knee pain of 3 weeks duration. So there is knee pain 3 weeks. It is worst during activity, settles with the rest. So this is Osgood-Schindler's disease. Then next question. 23-year rugby player falls directly onto the shoulder. There is pain and swelling of the shoulder joint. Clavicle is prominent. There is step-up deformity. So either clavicle fracture or dislocation of acromoclavicular joint. So there is no clavicular fracture, sternoclavicular. This is acromoclavicular dislocation. Next question. 18-year-old athlete attends the orthopedic clinic reporting pain and swelling over the medial aspect of the knee. Pain occurs when climbing the stairs but is not present when walking on the ground floor. Clinically, there is pain over the medial proximal tibia and McMurray test is negative. So there is no injury. This is pes bursitis. 80-year-old woman has a hip fracture. Her calcium is normal. She has never been given diagnosis of osteoporosis apart from treating the hip fracture with what additional intervention? So person needs calcium and bisphosphonates. 72-year-old lady stumbles and falls on the examination. She is tender in left groin and unable to bear the weight. Attempts at internal rotation produces severe pain. Plain films of the hip shows no obvious fracture. What is the best course of action? Tender on the left groin and unable to bear weight. So there is, on exam she is tender on the groin. Attempts internal rotation produces severe pain. Plain film of the shows no obvious fracture. There has to be some need of investigation. So whether MRI scan to understand the fracture. Let us see afterward. 50-year-old woman is admitted after falling from scaffolding. Age is 50 over. 50-year man. He has an open fracture of the tibia with 15 centimeter wound. He is neurovascular intact. What is the best? Neurovessels are intact. There is open fracture means this is classification. What you call it as grade 3. B is C is involvement. There is soft tissue is there. So immediate skeletal stabilization. Apply negative suction. No wound debridement. Emergency. No combined skeletal and soft tissue reconstruction. No application of external fixation. Intravenous photography. This is what is best initial is intravenous. This. Then 65-year-old Asian female with extracapsular. This is extracapsular neck of femur. 65 years. Calcium is okay, low. Phosphate is okay. Alkaline phosphatase is very high. What is most likely diagnosis? ALP is increased. Alkaline phosphatase is very high. Whether it is hypoparathyroidism or multiple myeloma or Paget's disease. Increased alkaline phosphatase. It can be in Paget's. Hypocalcemia is there. And phosphate is also low, and alkaline phosphatase. Let us see what is the answer. Hypoparathyroidism, hyperparathyroidism is going to increase hypoparathyroidism. Parathyroid is low. Alkaline phosphatase is increased maybe because of myeloma or Paget disease. Let's see Paget disease. 74-year male is admitted to the emergency department with fall. He is known to have rheumatoid arthritis and methotrexate paracetamol. He lives alone in the bungalow and playing golf. He is independent with. He complains of left groin pain. Therefore, hip X-ray confirmed displaced intracapsular fracture. This requires total hip. Alone, he is living alone. 86-year retired pharmacist admitted to the department fall. She complains of right hip pain, known to have hypertension. Currently, lives with the Zimmer frame. So, frame means hemiarthroplasty. 19-year-old female is involved in an athletic event. She has just completed a high jump when suddenly develops back pain and weakness. On examination, prominent sacrum. So there is spondylolisthesis, means that there is dislocation. 28-year-old man falls on the back of the hand, fractured distal radius. Back of the hand means volar displacement is there. There is opposite of Colles, that is Smith with eponum. This is Smith's fracture. 55-year-old motorcycle is involved in the road traffic accident, sustained Gustilo-Anderson type 3C, neurovascular enlarge. So he is trapped in the wreckage for 7 hours, more than 7 hours. 6 hours means he has lost all the vascularization, and this is amputation. Which type of fracture names best account for injury in 14-year-old boy who jumps off 10-foot wall and lands on both the feet, whose imaging shows bimalleolar fracture of right. This is bimalleolar. So bi is spots and tri is cottons. Spots fracture. So submitted. Let's see what is the result. Score is 11. Let's see the solutions. Radialist right. Instead of open reduction, intramedullary nail. This would be good case for intramedullary nailing. Open reduction and internal fixation would strip off otherwise healthy tissue. So second attempt you have to do intramedullary nailing. This was important. Osteolar goods, it's okay. Acromaclavicular dislocation is also right. Pace bursite is also right. Vitamin D bisphosphate is right. MRI scan. This is important. Patient is having left groin, unable to bear weight, attempt internal rotation pain, severe pain. Plain X-ray shows no obvious fracture. So MRI will diagnose who presently suspect deep fracture, but most accurate is MRI scan. Next is intravenous antibiotic. Okay. This is what I was thinking. What is Paget's? Multiple osteomalacia. Low calcium. So what is explanation? Low calcium, raised alkaline phosphatase. A low calcium and phosphatase combined with raised alkaline phosphate towards osteomalacia. Okay, this is another which. So this is also right. Total hip replacement. Hemiarthroplasty is also right. Spondylolisthesis. Young athletic female group most frequently affected by spondylolisthesis, who have background of spondylosis, whilst later condition, correct answer is listhesis. Here they have written spondylosis, but this is a fault of doing the answer. Actually, this is listhesis, spondylosis. They are not explained it properly. This answer is correct. I have marked listhesis, and there is mentioned listhesis. Okay. Again, what is this? This is Smith's fracture is right, but they are putting Barton's. So next, amputation is right. Potts is right. Fine. So there were only 2 wrongs, but they are not measured properly. Next examination, 15 questions. 5-year girl from the tree branch extended arm. Fell from the tree branch on her extended arm. She has seen in A&E diagnosed with supracondylar humerus fracture with inability to perform wrist extension. Orthopedic registrar was convinced that she has radial nerve injury. Which would be the relation of radial nerve to distal humerus? This is distal humerus. Here it is posterolateral. Post-branchial embolectomy, 73-year-old and pulseless, what would be the structure at the greater risk? This is branchial is very close to medial nerve. Now, 40-year-old mechanic presents with inability to adduct the thumb, following soft tissue injury to his forearm. Nerve is ulnar nerve. Actually, it is adductor pollicis. So it should be the deep branch of ulnar nerve. Superficial is supplying to skin. This is deep branch of adduct. From which of the following structure the long head of triceps? Long head of biceps from the supraglandular and triceps from the infraglandular tubercle. Radial nerve passes along the superior aspect of the which muscle as it exits axilla through triangular interval? Teres major. So this is triangular space. So teres major passes along the superior aspect of which of the muscle exits axilla through the triangular interval. So quadrilateral is axillary and radial is along the superior aspect of which of the muscle? Actually, this is exits the axilla through the triangular interval. So lower actually superior border is the pectoralis teres major. Let us see. 40-year-old gentleman was stabbed in the neck during his inferior trunk of brachial plexus, injuring the inferior trunk. Okay, you are been asked to assess his peripheral nerve function after he has LTSG found to be stable. What would be possible finding at least expected? So now this is what inferior trunk. Inferior trunk means most probably the ulnar nerve supply has to be lost. Flexion. Initiating abduction shoulder is from the superior abduction of the fingers. Adduction and abduction. Actually pad and dab. Ability to make fist. This is the radial and all that. Flexion of the little finger is possible because flexor profunda. So basic abduction of the fingers. Adduction abduction is by the ulnar nerve. That is lost. Which of the following is not a branch of posterior cord of brachial plexus? Posterior cord, radial nerve, axillary definitely there. Musculocutaneous is a branch of lateral cord and thoracodorsal. An orthopedic registrar tests your knowledge and anatomical stomach, which while you both assess the patient and he asks you about the medial border of the snub box. Medial, or it is also called as posterior border, is extensor pollicis longus. A teacher finds it difficult to write and complains of pain in her wrist when she tries to work for long hours. This is the median nerve, carpal tunnel, aberrant garner. So what is there? One is median nerve, anterolateral, deep ulnar nerve. Aberrant gangster muscle, what would be the neurological compromise? Is it AIN or median? Posterior anterolateral from the it can be Ganser's muscle, AIN, anterior anterolateral nerve. Let's see. A schizophrenic lady brought to A&E bleeding wrist after slashing a piece of glass. She tendons have escaped damage. What would be the least expected finding? At the wrist, tendons have escaped. What would be least expected finding? Least minimum finding will be loss of sensory. Tendons, loss of sensation of dorsal part of theron. No. Thinner is on this side. So loss of power, paresthesia of the second digit, thumb abduction, loss of sensation, maybe. Patient sustained a traction injury while working in machinery unit and MRI suspects injury to spinal accessory nerve. Which of the following would be clinical finding confirming the same? Spinal accessory nerve, that is supplying to trapezius and sternomastoid. So trapezius, it lifts the upward rotation of the shoulder, scapula. It is either protraction, let us see, upward rotation of shoulder. Which of the following is not related to capitate bone? Too pretty. Try to catch her. Capitate is third. She looks too pretty. Try to catch. It's like this. She looks too pretty. Try to catch her. Capitate, hamate. Capitate is the distal row. Third. Which of the following is not related to capital bone? So hamate is definitely by the side. Trapezium, trapezoid, capitate. Trapezoid is also side. She looks too pretty. Scaphoid is also in touch with. Try 2. 1, 2, 3 and 4. Scaphoid is also. Ulnar nerve is actually very much away from the capitate. Let us see. Cephalic vein pierces clavipectoral fascia and terminates into axillary vein. 72-year-old undergoes axillo-femur bypass. Which of the following structure aren't closely related to axillary artery? Axillary vein is there, posterior cord is there, pectoralis minor is making division, scalenus anterior muscle, lateral cord of brachial. Scalenus anterior is very much far away. Superior part of the fibrous capsule attaches to following structure. Anatomical neck, superior part, surgical is down. I will submit this. Let's see the answer and the exam. How much right you have got? It's 12. 3 are wrong. Let me see what are the 3. This is so. How it is anterior lateral? Fire girl from the tree. She has emergency department. It comes superior inability to perform wrist extension. Orthopedic registrar was convinced that she has radial nerve injury. What would be relation of radial nerve to distal humerus? So at 10 centimeter it comes interiorly. That's why it is anterior lateral. Okay. This is median nerve. No issue. Deep branch of ulnar nerve. Adduct. Yes. Infraglandular tubercle right. Teres major is also right. Initiating abduction of shoulder. What is this? Least likely. All they may be affected except initiating abduction. What would be possible finding is least to be lost. Abduction will be lost. Ability to make fist, flexion of the finger will be lost. So this is a neck inferior trunk, stabbed in the neck inferior trunk. So upper is saved. Okay. Musculocutaneous is the branch, right. Extensor pollicis longus, right. Anterior trochleus. It's not median nerve. Gangster muscle is supplied by AIN. Gangster in. Loss of sensation, dorsal aspect of thenar eminence, true. Upward rotation of the scapula, again trapezius is upward rotation. Now what is this? Which of the following is not related to capitate bone? Scaphoid is not related. She looks too pretty. Try to catch. So scaphoid is related to. Okay. The next question is axillary vein. Scalenus anticus, anatomical stump box. Okay, let's go for the third exam. Start. Which of the following structure doesn't pass anterior to lateral malleolus? So this is lateral malleolus. Peroneus tertius, peroneus brevis, peroneus tertius, peroneus anterior tibial. This is anterior to lateral, anterior tibial artery, extensor digitorum longus, lateral branch of sural nerve. Peroneus brevis or peroneus tertius. Peroneus PT is actually anterior. Peroneus longus and brevis passes anterior tibial artery is definitely following structure does not pass lateral. Now what is the sural nerve? May be passing posterior. Let us see. Lateral branches, sural nerve is not contained within the deep compartment. So sural nerve, it actually, sural nerve is very posterior tibial, tibialis posterior, flexor hallucis. Flexion is downward posterior, yes. At what level does sciatic nerve bifurcates into common peroneal and tibial nerve? In the pelvis, superior aspect of popliteal fossa. At the inferior aspect of popliteal fossa. It is at the superior aspect of popliteal fossa. While performing IND around the adductor compartment, the core trainee has been asked to worry about structures around the adductor longus, except this is adductor compartment. Long stiffness, tendon of iliacus, profunda brachii artery, pectineus muscle, femoral nerve. To vary the structures around adductor longus. Adductor long stiffness, tendinous iliacus. It is far away. Say a 73-year-old lady present with femoral hernia. Which of the following structure forms the lateral wall of femoral hernia? It's femoral vein. Which of the following statements relating sartorius is false? Is supplied with the femoral nerve. It forms the lateral boundary of femoral triangle. A medial third forms the roof of the adductor canal. Medial third forms the roof of the medial third. If it forms the lateral boundary, it is a flexor of the hip. Let us see. Oh, this is adductor canal, definitely. It is a flexor of the hip and knee. If it is flexor sartorius, it inserts into medial femoral condyle. Yes, flexor of the hip and knee is also true. It forms the lateral. It is supplied by the femoral nerve. Sartorius. It is a muscle of anterior compartment, and it is also sartorius is supplied by femoral nerve, right? It forms the lateral boundary of femoral triangle. Yes, adductor sartorius. It forms the medial third, forms the roof of middle third, forms the roof of adductor canal. So it is lower third. Let us see. Retraction of which of the structure gives good access to femoral artery in the groin while performing femoral popliteal bypass? You need to retract sartorius. A builder falls off the ladder while laying tiles. He sustains a burst fracture of L2. MRI scan shows complete nerve transection at L2. Which clinical sign would be initially absent? So L2 is there. So lumbar vertebra has, this person has lost the builder is fall of the, and now MRI shows complete nerve transection at L2. Extensive plantar response, flaccid paralysis of legs. So this is, initial loss will be initially as absent. Areflexia. Let us see. Which of the following does not exist the pelvis through greater sciatic foramen? Sciatic nerve, internal pudendal vessels, superior gluteal. I think obturator or internal pudendal vessels. PIN. This is 25-year-old shot in the groin and examination. He has a weak hip flexion and weak knee extension. Hip flexion is weak and knee extension. Hip flexion, knee extension, impaired quadriceps reflex, as well as sensory loss of anterior medial aspect of the thigh. Which structure has been affected? So this is femoral nerve. So femoral nerve is causing hip flexion, knee extension. 45-year-old motorcyclist sustains tibial fracture noted to anesthesia of the web space between the first second. This is deep peroneal. Which of the nerve listed below are most likely to be compromised? Deep peroneal. 20-year-old sustained a machinery injury, presented laceration of the superior lateral aspect of popliteal fossa. The medial aspect of the bicep femur is lacerated. Which of the following structures is greater? Common peroneal. During dissection of the groin, sartorial muscle is identified. Which nerve supplies to this muscle? Again, sartorius. It has to be from femoral only. Which of the following medial wall of the femoral canal? Shot in the posterior lateral aspect of thigh. Which of the following lies most lateral aspect of popliteal fossa? Common peroneal. Again 11. Go through solutions. Which of the following structure does not pass anterior to peroneus brevis? Deep sural is correct. Superior aspect fossa is correct. Tendon of iliac is far away. Femoral vein lateral boundary. It inserts into medial femoral condyle. Okay. False. So what is the right? It inserts into correct answer. It inserts. See, answer is not properly given. Which of the following statement relating to sartorius is false? If this is false, it inserts into medial femoral condyle. Then what is the right? Explanation is not given. Relation is access to, you have to retract sartorius. Okay. Extensor plantar response, that is called as Babinski's sign. What is this? Extensor plantar response, flaccid paralysis. It will not be earlier present. Internal pudendal vessels, obturator nerve. Which of the following? Obturator nerve. Okay. Femoral nerve. Deep peroneal, true. Common peroneal, this is right. Anterior division of femoral nerve, right. Lacunar ligament, right. Common peroneal, right. Our next exam, this is fourth one. Start exam, 15 questions. 5-month baby presents with swelling of the arm and found to have spiral fracture of the humerus and care of mother's boyfriend who was taken in bottle. What is the most likely cause? It is non-accidental injury. Cannot call it as accidental. 19-year-old female presents to the clinic with progressive pain. This 19-year-old progressive neck and the back and condition is worsening over the past 6 months. She has not presented previously because she was inpatient with the disease flare of ulcerative colitis. So ulcerative colitis is having ankylosing spondylosis associated. 5-year boy present with painful limp. Age is 5 year, painful limp. Present since 8 weeks. 2 hip x-ray performed and upper appear normal. What is the best course of action? Now, whether to do, this is 5 year. MRI, CT scan, x-ray, discharge and reassure. Symptoms have been present. Painful limp is there. So maybe this is septic arthritis. X-ray has been performed which appear normal. So you need some investigation, whether arrange further hip x-ray or MRI in 5-year-old baby. Lab investigation, aspiration, nothing is given. For joint, CT scan exposure will be very high. Let us see MRI. Which of the following types of growth plate fractures have similar radiological? 1 and 5 has got similar features. Now what is this? This is avulsion fracture of tibial tubercle, undisplaced fracture patella. Patella is this one, and this is the attachment, and there is avulsion fracture of tibial tubercle, Osler-Good-Schattler's disease. What is the age? Athlete is there, means Osler-Good-Schattler disease. (14-year boy presents with abnormal gait). This is 4 year, 4-year abnormal gait, history of viral illness, WBC is okay. This is transient, history of recent viral, transient. 1-year-old boy brought emergency history of failure to thrive on examination. Child is small for age and has large head and multiple cupping is there. Cup epiphysis. Let us see rickets. Which of the following is not typical feature of Talip's equinovarus? Adducted and inverted calcaneus. This is there. Medial displacement of navicular bone. This is also there. It is always unilateral. No, it can be bilateral. Wedge-shaped head of the talus. Severe plantar flexion. 12-year boy who is small for age present to clinic with poor muscular development with hypermobile fingers. X-ray showed multiple fractures, irregular patches of ossifications, osteogenesis imperfecta. 18-year athlete is admitted to emergency room for being hit in the knee by the hockey stick. On examination, knee is tense and swelling. And what is the diagnosis? X-ray shows no fractures. So when there is no fractures on X-ray, there can be avulsion fracture of tibial. No, there can be one of the two, patella fracture or dislocated patella. On examination, they tense and swollen, issue no fractures. So dislocated patella, which has been. 19-year-old sportswoman presents with knee pain, which is worse on walking down the stairs and sitting still. On examination, there is wasting of quadriceps and pseudo-locking of the knee. Sportswoman commonly is Osler. Let us see. Knee pain which is worse on walking down the stairs. And sitting still. On examination, the wasting of the quadriceps and pseudo-locking of the knee. What is the diagnosis? Knee joint is pseudo-locking. Osteoarthritis in so young patient, sportswoman. Let us see. Osler-Schattler disease, development, septic arthritis, transient synovitis, slip disc, development dysplasia. No, it is transient. Schattler disease, slip femoral. No, development dysplasia hip. No, Perthes is no, septic arthritis. No, transient synovitis. 10-year boy is referred to orthopedic clinic with simple symptoms of right knee pain. He has suffered pain for last 3 months and pain typically lasts for 10-year boy. On examination, he walks an antalgic gait. Age is higher. So now you have to think of symptoms of right. He has suffered pain for 3 months and pain typically lasts for several hours. Examination, walks antalgic gait, right leg shortening, knee, right hip pain on internal rotation and external rotation. Shows flattening of the femoral heads. So this is Perthes. 15-year boy with tiredness, throat infection, gradual loss of vision, multiple brittle bones. No differentiation between cortex and medulla is osteopetrosis. 15-year-old boy is brought to the clinic by his mother who is concerned about the mark overlying the lower spine. Occulta. Oh, 13. Non-accidental right. Arrange hip MRI. Yes. 5-year boy with limb pain. Hip MRI has to be done. Salter Harris type 1 right. And what is this? Osler-Schattler's disease. Transient synovitis. Rickets. Unilateral is not always. Osteogenesis imperfecta is right. dislocated patella. So it is chondromalacia patelli, quadriceps pseudolocking. Okay. This is again, question is correct answer. What is this? Osler-Schaller's disease is Perthes disease. Something wrong here. This is orthopedic clinic, pain and internal rotation, and there is flattening, right? Osteopetrosis, right? Spina bifida occulta. Now coming to last exam. Let's start. 15 questions. 18-year woman hip fracture. She has never been given diagnosis of osteoporosis. Apart from treating hip fracture, additional requirements is always calcium bisphosphonates. Second, 58-year-old patient to the plastic team with the burns to the hand. He is distressed by the hand, bilateral charcot joint. So this is central loss of sensation, syringomyelia. 24-year brought to the emergency having suffered crush injury to the forearm. Assessment demonstrates the arm is tender, swollen, and clear evidence of ulnar fracture. Patient can move the fingers. What is the most appropriate course of action? It is fasciotomy. 30-year man is admitted to overnight following traffic accident. He has open tibial fracture, 20 cm extensive peripheral stripping. He neuromuscular intact. IV antibiotics are already given. Stabilization negative, skeleton fraction, immediate vascular shunting no. Combined skeleton soft exertion, schedule operating list. This is the schedule operating list. 30-year man present with the pain in the left hip and present on and off many years, and 13-year gestation, emergency gestation, long bridge delivery, slow walk and child, and has the antalgic gait. So bridge delivery, and these are congenital DDH. 23-year-old man plays rugby and he has anterior dislocation of the shoulder. Which of the following abnormalities is likely to account for anterior dislocation recurrent in Bankart lesion? 20-year-old man hit over the head with a mallet. On arrival, open eyes to the pain. Pain is 2, groans is 2, extension is 2. It is 6. Painful stimuli, extend his arms to elbow. 6 I've done. 55-year-old motorcycle is involved in road traffic accident and sustains Gastelio Anderson type 3C fracture. He is trapped for 7 hours. Amputation. 32 close, unstable, managed with the intermittent nearing or return of the ward is noted to have increasing pain in the limb. Limb is swollen and tender and pain on passive stitching of the hand. More likely compartment. Where is their compartment? Right. 60-year-old admitted to emergency room, falls. He lives with the wife and restaurant manager. Total hip replacement. Intertrochanteric fracture. Anything else is given? On examination, there is right hip tenderness and movement of all direction. Hip X-ray confirms intertrochanteric fracture. This is 60-year-old dynamic hip screw. Let us see. 60-year female presents to the emergency room with tripping on the step. Complaints of shoulder pain. On examination, there is pain initiating the abduction. So supraspinatus tears, supraspinatus tears, supra, both are same. 22-year-old rugby player falls off his hand and sustains a fracture of distal radius. X-ray shows dorsal angulation fracture. What is the most appropriate treatment? Now this is, so you need admit, open reduction, internal fixation, reduce base block, no, discharge home, no. This is fixation is required. 42-year-old impacts his hand on the sky pole. On examination, there is tented anatomical snub box, X-ray scaphoid views, no evidence of fracture, most appropriate. Now this is admit, futura splint and fracture review in the clinic. 23-year-old rugby player for shoulder pain and swelling on the shoulder and clavicle is prominent, appears to be step of deformity, acromioclavicle joint dislocation. Submit it. Let's see the answers. How many are there? Only 12. Now what is this? Vitamin D, okay. Syringomyelia, okay. Fasciotomy is okay. Immediate skeletal stabilization application of negative pressure dressing. Now this has come. Combined skeletal and soft tissue reconstruction on schedule operating list. Immediate skeletal stabilization application of negative pressure. New vascular intact. IV antibiotic wound dressing has already given. Japan. What is most appropriate course of action? Okay. Bankhart's lesion, and previous was development dysplasia of the hip. Bankart lesion. This is 6. The same question again, 6. Amputation more than 6 hours. Compartment syndrome is 6. Dynamic hip screw. Okay, this is what I was thinking. Okay, this patient does not reach THR because it is intertochondric. Okay. Supraspinatus stair, both are true. There is the fault. Open reduction, internal fixation. Okay. Application of future splint is right. Acromioclavicular joint dislocation. So here I can stop this. It is around 41 minutes.